Hi, my name is Dr. Kathy Hubley Carruthers. I'm a private practice psychologist in the province of Nova Scotia. I'm here to talk to you about facing your fears in COVID-19 in the return to school process. I'm here to offer some strategies that may help educators and families in returning to school. Fear and anxiety are described interchangeably day to day, but fear is different than anxiety. Fear is an unpleasant, albeit necessary emotion, and it is caused by the belief or thought that something is dangerous, likely to cause threat. Fear is normal in COVID-19, and fear needs validation. We need to understand and be empathetic about fear. We cannot function as human beings without fear. Anxiety, on the other hand, is excessive fear and its related behavioral disturbances. It includes excessive worry, persistent reluctance or refusal to engage in certain activities. Anxiety is out of proportion, sometimes to the actual objective risk in the current context. In this case, here in Nova Scotia, at this time period, in this classroom, it may be that anxiety is an overappraisal of risk, the overestimation of risk, the underestimation of your ability to handle it, and the underestimation of others' ability to help you cope with it. Anxiety needs validation as well, but it also needs exposure. And I'll explain to you what exposure is all about. As educators, parents, and students, we need to figure out whether we're experiencing fear or anxiety. Here's a brief screener that may help you as educators and parents and students to figure out the difference. Are you experiencing fear, which is normal, a very appropriate response to COVID-19, or perhaps you're experiencing a more disproportionate response to this fear? This COVID-19 anxiety scale may help you to tell the difference. Some of the questions: do you feel dizzy or lightheaded when you listen to news about COVID-19? Do you have trouble falling or staying asleep because you were thinking about COVID-19? Do you feel paralyzed or frozen when thinking or exposed to the information you've received about COVID-19? Any of these things could indicate anxiety, not just fear. Did you lose interest in eating when you were thinking about COVID-19? Did you feel nauseous or have stomach problems when you were thinking about COVID-19? These are good screener questions to ask yourself, to ask your students, to ask parents, and if one or more of these are present, it may be appropriate to talk to a professional about that. One of the biggest indicators that you may be experiencing anxiety and not just fear is a persistent reluctance or refusal to engage in certain activities. So if you notice that a student may be persistently reluctant or refusing to engage in any activities for school, it may be related to anxiety. It's good to explore these things. There may be reluctance or refusals to engage in other activities associated with the return to school process, like mask wearing, for example, or social distancing. It may not just be a behavioral problem. It may be an offset, an offshoot of anxiety. So it's important to consider that reluctance or refusal may be part of anxiety. So what can we do if we figure out that there's fear at play, perhaps that there's anxiety at play? Well, the first and most important thing as educators, as family members, and as students is to validate and listen and be supportive. Now, validation isn't dismissing, it is basically saying, yes, I get it. It's not saying everything's going to be okay. We don't know that everything's going to be okay. It's saying, I get it, I understand it, it makes sense. We have to do this for our educators, we have to do this for our parents, we have to do it for the students, we have to do it for our kids. The next most important thing is to be honest, to acknowledge that in COVID-19, of course there's risk. We are not functioning outside of risk, but there's precautions that are in place to help us mitigate this risk, to help us to live within the risk. So it's important to acknowledge risk while emphasizing the precautions. After we've been honest, we've acknowledged there's risk, we've validated fear, it's then important to encourage graduated exposure. Let me explain to you what graduated exposure is. Exposure is going toward, not going away. In going toward the things that are scary, even though there may be some objective risk, we are tolerating that uncertainty and we are bringing down our arousal. We are learning to tolerate uncertainty. I'll explain a bit more about graduated exposure in a minute. The next most important step is to praise the courage then. So once we've validated, we've been honest, and our educators, our parents, and our students have gone toward, we need to praise their courage. We need to talk about how courageous that was and certainly let them know how important that is. As educators and parents in particular, it's important to model good coping, one day at a time. Enjoy the current day. Talk about the enthusiasm of going back to school. And we need to keep in mind our own self-care. If we're going to be there for parents, for students as educators, if we as parents can be there for our children, we have to take care of ourselves. So obviously we have to get good exercise, see our friends, go for our walks, go golfing, do whatever it is that makes you feel good. Reward yourself at the end of the school day and reward yourself for exposures, for the courage that you have. And it's also very important to communicate frequently and clearly about the risks, emphasize the precautions, keep talking about fear, not just on the first day of school, but all through the return to school process. It's normal to want to avoid things you fear. In COVID-19, it is normal to want to avoid going places like school. However, avoidance prevents you from learning that places or situations you fear are not as dangerous as you think, provided, of course, you take the necessary precautions that public health is recommending. Graduated, which means gradual exposure, repeated exposure, involves gradually and repeatedly going into the feared situations you feel, less anxious each time you go, with the necessary precautions in place, of course. If done correctly, graduated exposure can be very effective in overcoming fear and anxiety. It is important to start with situations that are less scary and work your way up to things that cause you a great deal of anxiety. Again, with the necessary precautions in place, as recommended by public health. So what do we do as an educator or a parent in getting our teachers, getting our parents, getting our students ready for graduated exposure? First thing we want to do is make a list of our fears. What we want to do is just put them all down on paper, write it down, make the list, write out the fears. What are they? They're normal, we need to validate them, we need to be empathic, we need to be self-compassionate about them. We have fears. After it's all in a list, let's build a fear ladder. In this case, we want to get to a specific goal. Let's take an educator who might be listing their fears. Maybe their biggest fear is to be in the classroom with their students with their masks on. That's the goal. We want to work toward that specific goal. That is perhaps, for the educator, a 10 out of 10 in terms of their fear hierarchy, meaning they have the most fear related to that particular situation. Then we want to consider what are easier steps that might lead them to that goal. We want to consider the length of time, the time of day, the environment, who they're with. What makes it easier for them to get into the classroom with their mask on to teach? What makes it easier or harder for you? We want to explore those things. We want to find out then what would bring it to a 9 out of 10 or an 8 out of 10 or lower. We want to start with what makes it easiest. So perhaps if we're curious about it, we might find out that it's easier to teach in a classroom if you know your curriculum. So maybe an easy step in getting to that ultimate goal would be to explore your curriculum, to basically sit down with the studies from the previous year, to go through those, to pretend to deliver that to your imaginary students at home, to get into that you're comfortable with. Maybe on the mask wearing portion of that, it would be easier to wear a mask someplace else other than in the classroom. So we put the masks on in easier situations, we teach in easier situations, and we figure out where those things land on our hierarchy. And then we plan the next activity. Once we have that activity that's easier, we figure out an activity that might be slightly harder, and so on. Then it's about exposing ourselves. It's about planning to go do those activities, then do them over and over again in a repeated fashion until which time our anxiety comes down. That's called habituation. Basically, we want to remain in the situation at each level of our hierarchy until the intensity of the fear we experience goes down by at least 50%. We've habituated to it, we've faced it, we've stayed in it in a prolonged, long enough fashion, and we've done it on a repeated basis until which time the fear goes away. Then we practice. We practice it over and over again. Maybe we practice in different situations. Maybe we practice with different people. Maybe we practice at different times of day. We practice over and over again until the day those school doors open and we're in our classroom with our students, with our curriculums, doing what we do best, teach. And then we reward ourselves. We go to the golf course, we go swimming, we go to the beach, we make the most of the next 3 weeks, and we reward ourselves for the courageous, graduated exposure, getting ourselves ready for the classroom. So these are the steps in graduated exposure. Make a list, build a fear ladder, consider the elements that make it easier for you. Start at the bottom, work your way up, plan it, stay in it, repeat it. Keep practicing, then reward yourself. These are the steps that will make it easier for you, your students, to get back to the classroom. Enjoy a wonderful school year.